Hi, good morning, everybody. This is Andrew Lalo, Shuti President. Actually, today was I think it's a very good lecture for everybody, especially people who are, getting elderly and living on their own, or even have family, but on the other hand, they don't recognize there's some issue. A lot of people actually do have some kind of, there's some people actually do develop depression without even knowing. And that's why today I thought perhaps it would be really good to actually present this information. If you have actual depressions, which you might not recognize, and actually can increase your heart attack and heart disease. And so today that lecture is trying to give you a sort of alertness to understand this can be happen. Now, I'll give you one good example. Actually, this is one of my uh, customer that who came in, and you look at him, he looks looking all right, but on the other hand, actually, he has a real, in a way, is a serious depression with a sudden illness that came out. And that illness basically, really, the doctor told him that, hey, we cannot do any much more. You have to accept it. And with that, without the acceptance, it becomes tremendous depression because it really cannot sleep. He lost 20 pounds. And then, even at a time that is could be potential suicidal. And so my advice is, hey, you cannot just continue to do this. You have to go to see a clinical psychiatrist, and in order for you to help you resolve this problem, because this is really a professional issue. And on top of that, he doesn't recognize that as a depression at all. It just does the bad situation occur. And so net result with the proper medication, professional, and a lot of things that we suggest they do, it turned him around. But that took almost like 7 to 8 months altogether to able to do that. And after that, he become a much better person. And net result, during that time, actually, there's a quite episode of really high issue that occur. It comes out. So, really at the end of the day, we realize a lot of time you might not just, you are like a normal person, and because certain situation comes up, it can turn you. So today I thought perhaps would be a very good webinar to help everybody better understand what is depression, why we have to look in that, and then why you have to actually get professional help. So shall we start? Okay. I think that is a real good one to let everybody know that, hey, that's something that, when as you get older, there's a lot of things happen and you might need more than a professional help. Okay. So let's start. And then today my lecture. Okay, so today our lecture is how depression can increase your heart risk. Now, a lot of people cannot usually not necessarily relate to that because they say, well, how can that, heart and my mind link together? And there's tremendous linkage. So we will sort of go through that together and better understand that together. Okay. So today's topic is we'll introduce, how depression affect your heart and your blood vessel and how that link with the mind, and what is the warning sign you watch for, and what is simple steps to lower your risk, and how can those shooters can help you. And so this is what we'll talk about today, and we'll have question and answer later on. Now, we have talked about four stage of diabetic, and I think a lot of people today I'm not familiar with. It took about a couple minutes just to catch up. Everybody go through four stages of diabetic. One is the high LDL cholesterol increase, it damage the B cell coming out from pancreas. The B cells will take sugar to the cell. The B cell will take sugar to the cells. The sugar will continue to circulate in the bloodstream. And that problem you're going to start, it will form plaque because the cholesterol and sugar together form plaques, and then it will start plugging throughout the body, the whole body. So you're going to start seeing cholesterol over the place of vessels. The space of vessel becomes smaller, the blood pressure go up. That's the second stage. And then you don't do anything because there's no sign symptom. You move very quick to the third stage, which is the third stage is the pre-diabetic syndrome, whereby everybody doctor will measure your blood hemoglobin and how many percent of sugar attached to hemoglobin. If you are 5.7 below, you're a normal person. 5.7 above, you are a pre-diabetic. If you don't do anything, you don't change your lifestyle, decrease your weight, you know what? Very quickly, it will change to diabetic, because the stage 4 will be a diabetic, meaning your HbA1c is between 6.4 and above. Okay, so meaning that during the time you're pre-diabetic, or even your LDL cholesterol start going up, you need to take something, change your lifestyle. Low sugar tea definitely help you. And I will talk a little bit more why low sugar can help you. Well, low sugar tea, there's actually two things. One is the guava leaf, which is delay the sugar absorption the gut vessels. Bitter melon increase insulin sensitivity, take sugar back in the cell, and then excess sugar, excess LDL cholesterol, and also salt will dump out through urine. They don't reabsorb back to the body. Net result, the salt go down, your blood pressure go down. So 3 high will definitely take care of you. And we have a lot of experience of our client. The A1C as high as 10% above, they actually drop it down to 5.7. But we don't want to just tell you, okay, drink tea, because we really want you to understand the whole disease process, and plus support you along the way. So we have a 5 program to help you to really improve your blood sugar. One is we teach you about drinking low sugar tea, which is you drink 6 to 8 times a day. We teach you about low carb diet and low fat diet. We also teach you about exercise, 8 to 10,000 steps, weight control. BMI will lower it from 30 to 23. You listen to a weekly webinar, which is free, like today, and then we'll teach you about daily blood tracking. Now, you might say, hey, where's all these things? Well, it's all in YouTube. You see this, you can take a picture of this and you can scan this, and you can access all the lecture. There's 400 lecture in there. So you basically go down www.youtube.com and /@ CTTEAS LOWSUTA/video. But you can't do all that. Just take a picture and get this QR code, and you can actually get in there and understand, all the lecture. You can select free time and to do your to see the lecture. So okay, let's get to the meat of the story. Why depressions really matter, and why depression affect your heart is a big thing. Because heart disease is a leading cause of death. In the whole world, there's 19.8 million of fatalities for cardiovascular disease, which is CVD, in 2022, and account to 32% of the global death. Now, that is a major number, right? Heart is like a car engine. If that doesn't work, the whole car will stop and die. And also, 85% were due to heart attack of this global death, and either a stroke or heart attack. So really, at the end of the day, heart disease is a big thing causing death if you don't take care of it. And depression in the world is a big number also. There are millions of adults can be depressed. And estimated is 5.7 adults suffer depression globally. 5.7% of the population. That's a big number. And 5.9% adult age 70 years of age older are also potential of this issue. And so really you recognize, the issue, and might help you to make your life a little happier. On top of it, you eliminate the cost of potential death of heart attack. And that is important. So that's why today we thought that would be good to provide this insight, so you can able to grapple with this and able to start doing something or maybe literally to come up to basically change your lifestyle or get doctor helps and so forth, so you limit the impact of a depression and then also affect your heart. So depression, actually, it is a medical condition, where it won't go away. You got to get treated. You have to get doctors to help you to provide either medication, therapy, all that stuff to help you to change, improve the depression and get you well. So that is important. And basically, what is depression is really a long-term, a lasting sadness. You don't feel happy, and is definitely it's not a weakness, but you can't snap out of it. Your brain and body basic is can be really influenced by this long-term sadness or depressed. You cannot sleep, your appetite is decreased, your energy is gone, motivation is gone. So sometimes so serious, people actually lost the interest of life. They kill themselves. So really, at the end of the day, you really affect how you feel, how you think, how you act. So net result, you really need to look at that. Do I have this problem? If I have this problem, I really need to get a professional help. And in the world, depression is so common. One every 20 adult, one adult in worldwide have depression, and affected 330 million people in the world have that. Especially women are very common, 6.9% with that is women, and can affect the people at any age. They can be young, old, and elderly. So a lot of elderly also, especially elderly now, because of the lack of support, they can be really easy to move into depression, and plus all the health issues that come along. So let's first identify what is heart disease first. So you understand heart disease, and later on we'll link the heart and mind together so you have better understanding. Now, first of all, heart disease, as known as cardiovascular disease, which is including a whole range of conditions, include your heart blood vessels that issue. There's a coronary artery disease, meaning sometimes, especially you see that in a lot of diabetic patients, the plaques start forming. Eventually, the vessel gets smaller and smaller in the heart on one of the coronary artery, and it's total plugged, and then your heart will stop because of the coronary artery disease. Plus, there's heart failure. The heart have 4 valves, and the valve have to be failed, especially when you're older. So all these are considered heart disease. And basically, this is a leading cause of global death, with estimated about 17.9 million deaths each year. So, and most of these deaths, 4 out of 5 this heart disease are due to a heart attack and stroke. So it is a major issue. So you have to understand that. I just give you some statistics to show you how serious that can be. Now, you must say, well, how's the heart linked to my brain, man? It's so far apart. Well, that's not true, because the brain control all the stress response, heart rate, blood pressure, mental health affect heart rate and often affect how you feel. And so link the mind and the heart are very, very close to each other. So, and especially when you stress and you don't feel well, you're depressed, your stress hormone will come out, affect all the heart, and the emotion is all affected your physical health. So it does link closely. So when another question is, how depression affect your body? Well, the thing is, as I mentioned, when you stress, your body will release the stress hormone, and the stress hormone, it give you extra strength all to your blood vessels and increase the blood pressure, your heart rate, and then it trigger inflammation, and it give you all kind of, you continue this stress because of depression, it will give you a tremendous long-term effect. And the inflammation is a major issue. Why? Because when you have chronic inflammation, because you're stressed, you have chronic inflammation, you make all the whole body inflamed, it damages your blood vessels. And also with the damage of blood vessels, you make your heart pump faster, and work harder. So the risk of heart attack and stroke can be increased. So you really do not want to get yourself the vessels always inflamed. You want to make sure it relax and make sure that it is not always stressed out for you. So, but interesting thing is when you are stressed out, you also do things that is not necessarily good to you, in a sense, healthy to you. Let's put it this way. Because people who are stressed out and depressed, they tend to, everything they care for themselves is decline. They show many different unhealthy habits that start forming. First of all, the first thing is when you stress, you depressed, you are less physically active. You know, where you say, oh, I'm so sick. Oh, I don't feel good. And all that will actually decrease your motivation, making you feel overwhelmed, and your movement will be lessened. And then because you don't move anymore, your weight start gaining, you start energy start decreasing, and then that result that drive to what? Really risk of cardiovascular disease. Now, certainly also, and the same thing is you lost appetite. You could be also poor diet choice because of the fact that you're stressed. So you might really going for a lot of like sugar item, like donuts, salty item, chips, to soothe that stress or the depression. And you really continue to eat a lot because you stress or don't feel good or you're depressed. So really at the end of the day, you feel fatigue, your blood sugar go up and down. And in long-term health, you basically your nutrients of the good nutrients are total whacked, not balanced. And especially if you go into deeper depression syndrome. That's why a lot of people who are depressed, they don't do well eating, they don't do well of anything. They just sit there and really feel bad for themselves. So you really are, because of that, you change your appetite, your weight is not going to go up. I mean, definitely will go up, and you go down also, either go up or go down because you are so stressed, and everything you do is so negative, affect your self-esteem, cardiovascular health, further complicated because of the fact that wow, you think that I'm really no good anymore, da, 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 and so forth and so forth. So all that will come along. Now, also another thing is you gotta start maybe potential. You start smoking, using alcohol to numb yourself, and that all coming along is also affect a long-term issue with the heart, and especially your heart already not doing well with that, it'll come in even getting worse. A lot of people has a major problem of sleep when they depress, because when you depress, all these things on your mind just affect, and so you basically sleeping is affected, and also affect your mood, and you can't concentrate, you can't work. I mean, you keep working because you're depressed, you continue to think of all the things that not working out, and become a sort of a vicious cycle. More and more you depress, more and more harder to manage. Now all these become a major mental health if you don't start taking care of early. And that result is mental health will affect your heart, it affect your heart attack, eventually get so serious, affect your heart attack. And so you really need to figure, starting understanding, hey, I have a depression. You need to start seeking really professional help to, control that and eventually turn it around and get well. And it doesn't go 1 to 2 doctor visit. You have to go to a few doctor visits to understand the situation, continue to improve, and it's take work and therapy. So really, at the end of the day, as I mentioned, is something that if you gotta really recognize early and really understand and start taking action to improve things. Now, depression and diabetic and blood pressure are very related. Now, when you're depressed, you know what? Because you start changing your habit, eating a lot of sugar, and you really increase a lot of risk of your type 2 diabetic. Your blood sugar go out of whack, and also because you're depressed and your blood pressure is also can go up very high because now you have a lot of the stress hormone come out, like cortisol, does elevate your blood pressure. And then you also decrease all your motivation to do self-care because you really said, hey man, I'm not really doing good. And you just start getting poor diet, you forget your medication, you forget about exercise. And so, and some people that who are depressed actually forget the daily blood pressure medication. Net result, 4 or 5 days missing the medication, the blood pressure go up to 200, 300, and they get stroke. Boy, that is terrible. So really, at the end of the day, you really need to figure out, hey, if I do that, how can I control that? And on top of that, if you miss your medication and your heart continues stress, your heart condition can be worse. So really, at the end of the day, your depression and the poor circulation blood pressure go up, which is accelerate more blood damage, vessel damage, strain your heart. And so net result, your heart attack complications keep eventually come more quickly, and you don't want to be in that position. So really, at the end of the day, it's not something, depression, I can do it just, lightly. And also, in addition, depression also come with quite a few of signs that you can be look at and identify, so you can seek medical doctor. You get persistent sadness and hopelessness. In other words, I feel so bad. I don't feel good. Oh no, at the end of the day, maybe I will die or I want to die. Now, a lot of these people recognize this as sadness there, and they basically usually just feel 1 or 2 days, it could be over. But if you really become depressed, you are going to ongoing sadness, and it's going worse and worse and worse. And you really basically a sense of you cannot improve. Basically, you sense that, okay? So really, you need to start understand you have this. You need to start looking for professional help and talk to your family and so forth and so forth to get that identified, to go start moving to some kind of help and therapy. Because during depressed, you're going to start losing interest. Matter of fact, you will tell people, don't come to see me. I'm not so good. And so you really lost interest of friends, visit, your activities will stop. You don't want to do any hobby. You don't want to socialize. And even the routine, meaningful to you all the time, for example, like garden work, you will basically say, I don't want to do that anymore. And as time goes on, it gets worse. Now, also your energy will fatigue and low energy. You no longer will have that kind of energy charge up to do work. And your change the sleep appetite will change. You can't sleep. You used to camp 7 hours. Now you're going 4 hours, 3 hours. I wake up middle of the night, cold sweat. Your appetite is gone. And you can't concentrate. You basically doing work. Everything is like you want to write a letter. You can't write a letter anymore. You kind of say, wow. And your brain is just drifting here and there. Or you can't even remembering things. The worst that you feel really start getting worthless or guilty of something. And you're feeling hopelessness about the future. And then as time goes on, you say, maybe I should die. And then the suicide will start coming in. So really, these are the serious warning signs. The reason why I provide this to you, because a lot of people in the early stage don't understand, and very quickly maybe within 2 months or 3 months can get down as far as the death and suicide, thought of death and suicide. So really, this is something that a lot of people don't understand, and really you need to identify early and grab hold of it and really start getting help as soon as you can. And you need professional help. Now, with that though, your brain is getting that issue, but how that link together back to my heart? Well, really at the end of the day, because you're all these stress, all these depression issue, your heart will become compensated by pumping faster, your blood pressure going up more. So net result, if you are usually about maybe 50 years old, your heart has already have some issue, then you really start getting a related heart problem coming in. Your heart problem will become pressure, your squeeze, fullness of the chest, radiate up to the brain, radiate from here, radiate from the shoulder, go up to the neck. Those are potential sign of truly heart issue and potential heart attack. And you have pain lasting more than a few minutes. You start shortness of breath, and usually you get very fatigued. It can be dizziness, and then you feel the heart become pumping, boom, 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 boom. That's called palpitation. So these are the signs showing that your heart may be potential issue. So again, if that issue, that's not to say, stay home, I stay a little while, will be better, because you are continually depressed. So continue stressing the heart. So you need that doctor to help you out to really release your stress, your depression, and eventually your heart can be safe. So net result, you cannot just sort of rest and I will do it better tomorrow. And you won't, because you are already depressed. You don't usually want to see doctor already. It's because you psychologically, you're not there. So really, at the end of the day, you see some of these signs, symptoms, you gotta get doctor help. Now, who are these people at high risk? Well, if you are diabetic, you can be really potential this first problem occur. You might be overweight and also obese, and you have a family who have history of heart disease, or who are the long-term, or the people that who are long-term stress and depression. And a lot of people have that. The depression could be from family, the depression could be stress, and also you are over age 40 already, you have high blood pressure, and your lifestyle, you don't move. It's a sedation lifestyle. Now, I'll give you one example. We have this one of the family. They are very, very rich, millions of dollars. And the sad part is, you know how Chinese is. They gave everything to the son. Okay, while they're still alive, everything to the son, sign over. And the mom has no more money. And asks the sons don't want to give. And she become totally depressed. Very depressed because of the fact that the son don't give her any money, don't give her support. And she felt, hey, this is my son, man. I basically support you to grow up, and now I am not. So net result, that relationship becomes shattered. But don't forget, these become a stroke, a depression. So net result, they really have to see the doctor, help them, a therapist, help them to smooth out the relationship, and so forth. So, the old lady, basically with that, the stress so much affected her heart. So really, at the end of the day, all these things can be major issue. So how a simple step to lower that risk? Now, really, I think the first thing you got to do is understand you have the issue, the depression. And you also, your heart might not do well, or you might have some issue of diabetic, which is your heart for sure always have some issue. So you need to talk about, a therapy, a counselor, to talking about your issue, understand your issue, and it could be a psychiatrist to help you out. Now, with that, you can have a medication from the psychiatrist give you antidepressant drug. So it turns that sadness to a better mood or stabilize your thinking much better, feeling more positive. Now, you have to stay physically active, not necessarily just exercise. Walk. We'll go around, walk in the shopping center. The walking shopping center can help you to open your mind. At least you say, wow, I got to see the whole world anymore. I mean, I don't see, if you stay home, you get very depressed. But when I go outside, I see the world. I go to the park, look at it, it's beautiful green, blue sky. And that result, you feel more open rather than stay home and feel sad all the time. So stay physical active is really good. Not necessarily go to the gym, but it's just go to walk around, see people, see shopping mall. And you got to get enough sleep, meaning that you got to have 7 to 8 hours sleep, not 4, not 3. Now, also a lot of people, when you depress, besides you get antidepressant drug, the doctor also might give you some very good relaxing pills so you get able to do sleeping well. And that's something that it can give you a potential help to really get you good sleep. Because without good sleep, you can be, without good quality sleep, let's put it this way, and you can become even more stressed during the day. because poor sleep increase stress hormone, blood pressure, and good sleep give you better emotional resilience and better heart health. And that is important. And you got to eat a healthy diet. Like, for example, you have to choose a lot of beautiful fruits, vegetable, whole grain, lean protein, all those good things that help you to be getting a very good balanced diet, not a lot of sugar, but just a lot of fruits. And net result, you can basically have all these things done. It will help you to give you a overall break out that cycle of depression and lead to your heart disease. And so you live a healthier and more resilient life. Now that is important. Okay. So very simple step, but you can able to help that tremendously. Now, certainly we talk a lot about stress and mood. Really, to help you to decrease this stress and build better mood, you have to connect your loved ones, the family, your husband, your children, your friends. If your children are around, go get to your friends, talk to them, play some mahjong, whatever that help you to connect, or even take them out to afternoon tea, talk. Very important is share your issue, your stress, your issue with your friends. And more important is people engagement. You need to have that. I know as we get older, it's harder and harder to engage people together. But nevertheless, you can even don't have to spend money to meet each other in a park, talk to them, and you can able to get that. And you have to celebrate your progress, acknowledge that, what your need is, and any change, any improvement, think that, wow, we got to celebrate. We'll get it done. It's great. You can help. And you need to change the bad, negative thinking to a positive thinking. And that's so important because holding on, it become negative. Oh, no, if everything work. Rather than say, hey, everything work. Tomorrow will be a better day. Now, we do that and become more and more changing the whole sad mood. And you have to set realistic, achievable goal to reduce stress. Don't set so high goal that you can't achieve. So you got to really to be very realistic. This is one step, small step, small step. You get there. Also, maybe you can do some meditation. One of my customer, what I did is went to go Tai Chi. Never did Tai Chi before, but now I get Tai Chi. And he think it was really helpful. The meditation, Tai Chi, exercise, all that become good. And he just went to a park, met some people and start doing it. And his whole body become much better and his whole outlook is much better. And now he met some Tai Chi friends. So they're more funny and more fun and really become a whole different change of his life and become better. One day we do have a tea called Proliver tea, which decreases stress and improve your mood. And later on we'll talk a little bit more, and that definitely help you than that. Now, as I mentioned, if you're depressed, your symptom lasts over 2 weeks, you got to get professional help. You cannot just stay home and think that I sleep it over. It doesn't work. It's not like that. You got to look for a psychiatrist to help you, or maybe first go to your family doctor to get you recommended. You got to start that. Secondly, if you start getting heart symptom appear to be start worsening, meaning that I've had a time breathing, shortness of breath, pain come up from here, go up to the neck, going. Now those are serious signs. We need to, and you continue to feel squeezing. That's no good. You gotta really go see a doctor quickly, especially if heart pain, shortness of breath, and that pain go radiate up your shoulder up to the neck, going to here. It's not even going to the doctor, go to the emergency room because you are part experiencing heart attack. And on top of that, you have to manage your blood sugar and you have to manage your blood pressure. And that, if your blood sugar continue to go up high, meaning that you are now 200 milligram per deal, or you already 11 or 12, well, you need to manage that. Your blood pressure go up to over 200, you definitely need to manage that. So those are things that you gotta see doctors. It's not just to, say, I will wait a little while. It can't wait. because it won't go away. You have to take action. So at the end of the day, we did talk about prolific tea, which is a tea that is made of very 100% natural herb that supports your liver clearness, but more important, improve your mood and detoxify function. Plus, because it lower your fatty liver improve your fatty liver, and basically it decrease your stress and heal overall mood. It nurture your emotional harmony, reduce high blood pressure, and improve your sleep quality. And this tea is specially actually made for our diabetic friends because a lot of times they can't sleep. They tend to have very stress work. So net result will get this tea to help them to decrease the stress. So with that, then they can, with the less stress, the blood sugar doesn't go up. Sorry, and then with sort of a tea that calm the nerve and really help them to improve overall emotion issue and better mood to help them live life happier. So in conclusion, depression can lead to heart disease and actually increase the heart disease risk. And as you know, the mind do work with the heart because what happened is when your mind is stressed, it affects your heart because it affects your blood pressure, increase your heart rate, and pump your heart, you get palpitation, boom, 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 all that affected. And you really you have to treat depression to protect your heart because you don't do that, you continue depressed, might end up with a heart attack and you die. And you don't want to do that. And you have to seek early treatment to the depression. So you have to control the depression, improve depression, you feel better, so it doesn't continue long-term affect your heart, and net result, you might be seriously affected down as we move on. And really take just small steps. And really small step is you got to get activities, go out, see friends, talk to people, very small activities. But net result, you actually improve your emotional health. You can't ignore that. It won't sleep over. It won't able to help you to get well. It doesn't. You gotta get professional help. So you need to continue work on it and support with your doctor treatment, and that result, your whole life will improve. You get well, it will affect your heart, and that result, you're a much better man, a much better woman. So that reason why I take this lecture seriously, because I saw quite a few of my customers have that issue, and when they have that, they tend to change a different person. 6 months ago, man, this guy is totally almost like ready to die. And 6 months later, because of the fact that they got seek doctor help and do all that, you know what? They feel so much better and no longer depressed. And they work with many friends. They start going out, going to have dinner, and enjoy life. And they become a better person. Well, thank you very much. Today, webinar, I hope that will help you. And you have any question, feel free to write to me at andy@wahfong.com, andy@wahfong.com. Write to me. Love to answer your questions. And if you have any issue, or future topic, want to listen more, give us a call. Let me give you some suggestions. We're looking forward to hear from you. And hope that you're going to have a wonderful weekend. I hope you can enjoy, all life around you in the sense that beautiful blue sky, go to walk in the park, get active, meeting friends, talk about your potential issue, or even don't talk about issue, talk about your what's going on. Man, these guys is going to love you and you will love them. Okay, take care, my friend. I hope you enjoyed this webinar. I hope it helped you on really at the end of the day, get you better life. So we'll see you next week. Thank you very much for joining our webinar. Take care. Bye.